Hey everyone, welcome to Professor Long's Lectures in Anatomy and Physiology. I'm Professor Bob Long. If you're watching these videos, you're either enrolled in my class, my Human Anatomy and Physiology Part 1 class, or you stumbled across this from the internet. If you're on the internet, please know you got to cover the information the way that your instructors want you to learn the information. We're doing it at Del Mar, our way. I'm presenting the information in a fashion that I want my students to learn it. So, your instructors may go into more detail into other areas. This is what we're doing where I'm at. So if you're in my class, learn this information. We're on page 4 of our list of things to know. We're on lab activity number 2, and we're going to be going over the directional terminology. Now, I've discussed this in one of the video lectures, but now we're going to see it in lab and how we can ask questions in lab. So the first two definitions that you see on the page are supine and prone. So prone is if somebody were lying face down in correct anatomical position. That would be considered prone position. If somebody was lying in a supine position, then they would be lying where they're looking up at the ceiling, okay? And that's important for those of you that, for example, that go into nursing or surgical tech. When you're positioning patients, doctors will do certain surgeries in supine position or prone position, and you need to know that. Now, we're going to use directional terminology, or what is called relative positioning, because the terms will tell you which direction to move on the human body, or they'll tell you the position of one structure relative to something else. So we call this directional terminology or relative positioning, and I'm going to run through all the terms with you here on the model, and I'll show you how we'll ask them in lab. So the first two terms are superior and inferior. Superior means above or on top of, and inferior means below. And you have to remember when we're using these terms that we're talking about correct anatomical position. So we're talking about someone standing facing you, their feet are together, their hands are at their sides, and their palms are forward. This gentleman is not in correct anatomical position, but we'll go with it for now. So superior would be something above, and inferior would be something below. Like the chin is superior to the thorax, or the umbilicus, your belly button, is inferior to your nose. So it tells you which direction to move or where something is located in relation to something else. The next two terms are going to be anterior and posterior. Now in human anatomy, because we are upright, we use the term anterior or ventral interchangeably. On a four-legged creature, they don't have an anterior and posterior. Their ventral surface would be their belly surface, and the dorsal surface would be the posterior of what we call in anatomy and physiology. So this would be anterior. If I turned him sideways, we would have anterior and posterior, or we could say ventral and dorsal. So let's say, for example, on a lab test, you saw a picture of this model, and we had a little letter A here and a letter B. We might ask you, please, oops, my tape fell off. Sorry about that. We might ask you a question that says something like, A is blank to B, and you would say superior. Or B is blank to A, and you would say inferior. Okay. If I flip someone this way, and we put A and B this way, A would be anterior, B would be posterior. Or you could say ventral and dorsal. So if I asked you, please describe A in relation to B, one person might say anterior, another person might say ventral, and they would both be correct, okay? So, now the next two terms we can talk about are going to be medial and lateral. Medial means closer to the midline, lateral means off to the side. So again, if I threw a little A here and a little B here, if I asked you on a lab test, please describe A compared to B, you would say A is medial, or you would just write the word medial. B would be lateral. When it comes to our joints, we have a medial surface and a lateral surface. Medial would always be closer to midline. Lateral would be always off to the side or further out. And one of the things you have to remember is, because our hand in correct anatomical position would be this way, the little finger is the most medial, the thumb would be the most lateral of your fingers. Okay? So medial means closer to the midline, lateral means off to the side or farther away from midline. We then have proximal and distal. Now, proximal and distal give a lot of students fits, and here's why. When we're talking about the entire body, we use the terms superior and inferior. For example, the elbow is superior to the knee in correct anatomical position. But when we're talking about a single limb, especially in a clinical setting, We use the term proximal and distal on the limb. And proximal and distal are always going to be used in relation to the point of attachment. So on your arm, it would be the shoulder, or on the legs, it would be the hip. So anything closer to the point of attachment would be considered proximal, as in like close proximity. Anything farther away from the point attachment would be said to be distal, or more distant. If you speak Spanish, you know próxima and distante. So if I were to ask you on a lab test, please describe A compared to B. Since we're talking about only his right arm, A would be distal to B. Now, technically, we could interchange that with superior and inferior, but you have to throw a qualifier in there. I would have to say, relative to the vertical plane, A is inferior to B. Relative to the point of attachment, A is distal to B. In a clinical setting, they're not going to do that. When you're talking about a limb and you're in the OR, they're talking about proximal and distal. Same thing for the leg. A would be proximal, B would be distal. Your knee is proximal to the ankle because the knee is closer to the point of attachment than the ankle is. The ankle is distal to the knee. Make sense? So full body, superior, inferior. A single limb, proximal, distal. Okay? Now, the last two that we can talk about are called superficial and deep. And I'm going to get a different model for you so that I can demonstrate this one. This model represents your skin. This is the surface of the skin, so this would be superficial. This down here would be deep. So if we put some letters on here, and they don't always have to be A's and B's, it could be any letters of the alphabet, but A would be superficial and B would be deep. Superficial means closer to the body. Deep means deep, I guess down below the surface. So if someone has a superficial wound, that would be like a light scratch. A deep wound would be a big gash where you could see down to muscle and bone and other tissues. So you guys need to practice these terms. We have pictures of this model, of these two models, on the Anatomy and Physiology Resources site. And if you go through my introduction, it'll tell you how to log into that and how to get pictures of these models. We even have a picture of this guy faced backwards so that we can also practice our regional terminology. So make sure you download these images, make sure you go through your lab manual and your lecture text, and you practice using all of this: superficial, deep, medial, lateral. And there's even a short exercise in the lab manual and in my note set for you to compare some of these terms. Okay? I hope you learned something. I hope you had as much fun as I did. Do this till you can't stand it. Do it till you understand it and can explain it to someone else. And I'll see you on the flip side. Thanks for watching.